Hello everybody, my name is Mariah Kennett. First of all, congrats to everybody on all your hard work and dedication you've put into receiving your BSN. The purpose of this presentation is to share with everybody about the project that I presented on, things I thought went really well with my project, and things I thought I could have done better. I completed my practicum at St. Elizabeth's Hospital in O'Fallon. I am currently employed there and I work on the telemetry units, ICU, pretty much everywhere. My preceptor was Julie Gordon. She is the educator of the intensive care unit and she's been there for about 20 years. I did my presentation on delirium in the ICU with a focus on nurse-driven interventions. The reason why I chose this topic was Julie Gordon had introduced the CAM ICU assessment, which is a tool that we use to assess for delirium in the ICU for our patients. She had completed her master's at McKendree University, and that was part of her final project. So for the past year, we've really focused on making sure we're doing our assessments every shift and trying to see which patients are CAM ICU positive and which ones are not. Now, although this has been going relatively okay, there's still some struggles with it, which is why I took my focus on delirium in the ICU and then narrowed it down on nurse-driven interventions. I felt that using a combination of handouts, PowerPoint presentation, and a video would best benefit my project and the nurses that I was presenting to. I did my presentation during a critical care Core 1 class. This class is required by all nurses who might work in the ICU or who currently work in the ICU. The class consisted of about 15 nurses. About half of these nurses were full-time ICU nurses, and about the other half were float nurses. Now, some of these nurses, especially the ones who are floats, had been nurses for probably some of them 10, 15, 20 years, but they haven't spent much time in the ICU. It's required by all ICU nurses within the year of starting to take this critical care Core 1 class, and it really just focuses on the basics of ICU nursing. The purpose of the project was to discuss with these individuals how delirium can be detrimental to a patient's outcome, causing increased cost, increased length of stay, and increased risk of death for these patients. I reviewed the two current assessment tools that we used during my presentation, which is the RASS score and the CAM ICU score. I did have a worksheet that went along with the CAM ICU flow sheet to kind of better explain how you would measure a patient's delirium, whether they're positive or negative. It can prove to be kind of difficult, especially when you have a patient who's maybe intubated and sedated, or you're not quite sure of their history. And the worksheet kind of gave a better understanding of how you would assess these patients. And then the last part of my project or my presentation was to focus on the nurse-driven interventions. So I talked to them about early ambulation, sleep promotion, and reorientation. Those are three things that they as nurses can do that can help treat and prevent delirium. When I discussed the early ambulation, I presented a video to them from the Johns Hopkins Hospital, and this video talked about how they were implementing the early ambulation of their intubated and sedated patients. They talked about how they took these patients off of sedation, how they got them up to chairs, they ambulated them in the hallways, and how this really improved their outcomes and reduced their number of days that they were delirious or prevented them from experiencing delirium at all. I also talked about, the sleep promotion, about how, letting your patients rest, trying to group care together, and reorientation, where we discussed using the whiteboards and talking to our patients, telling them, hey, hey, Mr. Jones, today is Monday, May 5th. This is kind of things that they can do on their own that don't require a doctor's order for them to complete. I did not want to just go and present information that has already been heard or talk about something that they were well educated in. I wanted to bring new ideas, new information, and new insight to these nurses that they could bring into their own practice. I really wanted to facilitate communication between myself and the nurses I was presenting to. So during my presentation, I asked them why or why not they felt like they could do these interventions, what are some barriers that were preventing them from completing these interventions, and a lot of it was staffing, which I know is an issue kind of across the United States. And we talked about things we could do to, even though we may have been short-staffed, to kind of implement these interventions. I really had a wonderful time during my practicum and completing my final project. I really wasn't well versed in delirium and the CAM-ICU assessment. Although I'd been trained on it, I didn't feel like I fully grasped it until after I completed this project. I felt like bringing the new information, the nurse-driven interventions, and asking the open-ended questions worked very well for my project. I had a wonderful preceptor. She worked with me every step of the way. She always provided me with new ideas, told me things that were going well in the ICU, things that she thought weren't going so well, and we worked together to create this project. If I were to do this presentation again, I would definitely open it up to every ICU nurse, as well as physical therapists, respiratory therapists, physicians, and other staff, because I feel like in order for nurses to complete these interventions, they need everybody on board. They need a physical therapist helping them ambulate these patients. We need to remind, respiratory therapists, doctors, physical therapists, do not wake these patients up if we're having a rest time and things like that. And that everybody needs to work on the same page and work together in order for this to work. And I wish I would have been able to present to more individuals. During my practicum, I was able to participate in a lot of new experiences, such as a code committee meeting, a peer review, which I had never been a part of before. And after being a part of this first meeting, I actually joined the peer review council at my hospital. So I'm very excited about that. I feel like this experience has made me a better nurse. I have a better understanding of my leaders, my managers. I have a better understanding of things that they must do, things they must know in order to keep the units running, and that how their dedication, their education levels, and practices can make or break a unit, really. I feel like I'm a more dedicated nurse. I feel like I'm more dedicated to educating myself and making myself a better nurse. I really enjoyed the education aspect of this experience, of standing up and teaching individuals about a topic they might not know very much about. I felt like that was something I could see myself doing in a few years, even though I do love bedside nursing. I've actually now am considering more to go back for my master's, but we'll see where things go. I really appreciate everybody taking the time to listen and watch my video. I've attached my presentation for you guys to view if you'd like. Thank you everybody much, and enjoy your free summer.